The COVID memorial wall on London's South Bank has become a vivid reminder of the toll of this pandemic. But now there is also the hard copy, a 217-page report by the UK COVID-19 inquiry, a memorial of sorts in its own right. And the chair of the inquiry had this to say.
I have no hesitation in concluding that the processes, planning and policy of the civil contingency structures across the United Kingdom failed the citizens of all four nations. The harrowing accounts of loss and grief given by the bereaved witnesses and others who suffered during the pandemic serve to remind us why there must be radical reform.
This report makes for a hard read. While it steers away from making individual criticisms, it confirms what many people had come to believe, that the UK was ill prepared for this pandemic. It was looking in the wrong direction at influenza. In fact, the report says that in 2019, the UK was widely believed to be one of the best prepared countries in the world. This belief, Baroness Hallett said, was dangerously mistaken. At least 240,000 people have died in the UK, but Trisha Barnett's brother Lawrence isn't in those numbers because he died too early in the pandemic.
My brother died the week before lockdown. This module, this report's about preparedness, and he's a really significant case, as alongside so many others that are unreported, of unpreparedness, in as much as a perfectly healthy man has a hospital appointment the week before lockdown. He arrives in the hospital, a healthy man just with an eye problem, and none of the staff in the hospital have face masks on, and he dies the same week.
Going into the pandemic, the inquiry found there had been a slowdown in health improvement and health inequalities had widened. Public services, particularly health and social care, were running close to, if not beyond capacity in normal times. But today, this was the bereaved family's response to the report.
While the inquiry has diagnosed much of what undermined our response, Lady Hallett hasn't gone far enough in setting out how we can challenge, address and improve inequalities and capacity of public services.
If anything summed up the problem with that planning, it was this graphic presented to the inquiry. Like a bowl of spaghetti, the number of organisations responsible for pandemic preparedness had multiplied over the years, yet nobody who gave evidence to the inquiry could explain why it had become so complex. Had the UK been better prepared for and more resilient to the pandemic, some of the financial and human costs may have been avoided.
One of the first lines of defence to a pandemic is containment. And this requires a system of test, trace and isolate that can be rapidly scaled up to meet the demands of a major outbreak. This did not exist in the United Kingdom when the COVID-19 pandemic struck.
PPE should also have been stockpiled in advance in sufficient quantities and fit-tested and connected to an effective distribution network. Baroness Hallett makes 10 recommendations which she said she expected to be implemented, including having a single cabinet level or ministerial committee responsible for planning and preparedness. There should be, she said, a UK-wide pandemic response exercise every 3 years and a report written within 3 months on the findings, lessons and recommendations, as well as an action plan published within 6 months. And she wants external red teams of experts from outside Whitehall and government to be brought in to challenge and guard against the known problem of groupthink. In her foreword to the report, Lady Hallett said, "It's not a question of if another pandemic will strike, but when. The evidence is overwhelmingly to the effect," she said, "that another pandemic, potentially one that is even more transmissible and lethal, is likely to occur in the near to medium future."